The global dream of ending HIV by 2030 is nearing reality following the approval of Lenacapavir by the US Food and Drug Administration on the 18th last month. Lenacapavir is an HIV injectable PrEP that is administered twice annually to HIV-negative individuals to prevent them from acquiring HIV. The director, Uganda Virus Research Institute, Professor Pontiano Caleb, has expressed optimism that this milestone, coupled with other HIV prevention interventions, will help curb new HIV infections.
It's a wonder drug which can be used for treatment of HIV, but very important also for prevention as PrEP. It's an injection that is given twice in a year. And in the studies whereby even Uganda institutions were involved, it showed very, very good results in preventing the transmission of HIV. So I think it will add to the different approaches in trying to end HIV/AIDS as a public health disease by 2030.
Dr. Flavia Matovu, who was the principal investigator for Purpose 1 study on Lenacapavir in Uganda, described the breakthrough as exciting news.
The next step is for each country to work with their local authorities to make sure that the drug is approved. For example, here we have the National Drug Authority. They have to approve Lenacapavir and to register it in Uganda, and thereafter Ministry of Health has to revise the guidelines, because we have guidelines for PrEP. Already we have oral PrEP that's been effective, but the uptake is very low, and also persistence. People come for it and then they stop after a while.
The concern remains on the availability and accessibility of Len to low-income countries.
Development of these drugs is expensive. There's a lot that has gone in. There's been research on this drug for more than 20 years. From the lab, the science, because it's such a good drug, it uses a different approach mechanism, unlike the drugs that we have. A new mechanism, which is so exciting to us. So a lot of research has gone on. In the lab, people discovered it, then the studies and the trials. So we need also to be, as we want the cost to go down, we need also to be, to also recognize that companies also have to get some profits to fund their research and future research, otherwise they collapse. So that has also to be taken into consideration. The research is expensive, so companies have to get back some of the money they have invested. So we hope we can use the current global networks, UNAIDS, the Clinton Foundation, PEPFAR, and other organizations that are more global to put some mechanism that may include negotiating tier costing, whereby the cost of the drugs could be different. Those in the rich countries, they sell at a higher price than those in the low countries. So tier pricing can happen. Pooled procurement mechanism, Clinton Foundation and others have done it, that if you have a big market, you procure big consignments, they go to Africa, they go to Asia, they go to Latin America. The companies may feel good about it, that they'll make money because there's somebody who's buying a lot at a cheaper price. So pooled procurement is very, very important.
So it's a lot of investment, a lot of time, and therefore you expect that this drug has to be priced a bit higher than what we can afford here. And therefore what Gilead did, even before the FDA approval came in, they had already signed agreements, licensing agreements with 6 drug manufacturers who can make generic versions at a cheaper price. Because they've not funded the study, they've not invested much, they are able to negotiate with Gilead Sciences to be able to provide the drug at a much fairer price than what the brand version would cost.
So Uganda will have to align her HIV treatment guidelines to incorporate Lenacapavir. Adia Nakote, UBC.